Hi everyone, it's Dr. Aaron here. I'm an aesthetic physician at Preventus Cosmetic Medicine. Today's topic is the male aesthetic. As people are probably obviously aware, there's a big difference between the male aesthetic versus the female aesthetic. Now we use the same tools in our toolbox, things like dermal fillers and toxins to treat both the male and female face. But there's distinct differences as to how we approach that. The female aesthetic is all about gentle curves, heart-shaped, oval-shaped, gentle, subtle beauty. Whereas the male tends to be a bit more sharp, a bit more square, a bit more bold. So in addition to skincare, I get these treatments as well, toxin especially every sort of 3 to 4 months in my forehead, around my eyes, and in the frown lines. Not really to sort of masculinize or to enhance my masculine aesthetic, but more for an anti-aging. I've had fillers under my eyes and in an old hockey injury, believe it or not. I've had some filler in my cheek as well. Again, just for more anti-aging, to achieve some symmetry, not necessarily to enhance my male aesthetic. So oftentimes when patients come in for a consult, they have this ideal aesthetic of what they want to look like or what they see in social media. So oftentimes we will talk about certain celebrities like Zac Efron or Brad Pitt, because patients will have specific questions about, well, what makes them look male? I want to sort of look like that. Now, we don't know for sure. We have some ideas. I definitely have some ideas as to what they may or may not have done. But this is one of the things we will discuss with patients regarding, basically, again, the difference between the female versus the male aesthetic and how we can have the patient's concerns addressed to maybe reflect or to look like what they're looking for when they see someone on social media. So, like I mentioned earlier, this is Zac Efron. Not quite the same sort of angles as far as befores and afters, but the one thing, as the arrow probably gives away, he's had some fillers done because his chin cleft from the before is now obviously disappeared. And the only way to get rid of that is to add some volume. So that's definitely a filler thing. He definitely has the male features with the squareness of the jawline and the sharpness of the chin. The one thing you wonder about, unfortunately, because he's smiling, you don't quite know, but you see on this before photo, he definitely has some sort of gentle curve on his right cheek, which likely has disappeared. It's tough because he is smiling, but when you just even compare this area versus this area, it definitely looks a bit fuller. And this is definitely one place where you will add some filler in the male cheek to enhance that sort of squareness and reduce some of the gentle curves, which can sort of be interpreted as part of the female aesthetic. So here we have 3 more examples, famous actors, obviously. And it's more, I'm just going to sort of review here, again, what sort of gives the features that you're looking for with the male aesthetic. With Chris Pine, the arrow is just pointing at the transition essentially between the chin and the jawline. So the things with the male aesthetic, it's the squareness. So the width of the cheek and the jaw are almost vertical. You've got a sharply defined chin or a jawline, and then sort of the width of the chin. You can see there on this photo, the definite right angle and the prominence at the angle of the jaw. And with Brad Pitt, you're just a bit older, but you're accentuating, again, all these features. The squareness of the side of the face, his masseter muscles are actually even a little bit wider down here than the cheek. So he's actually even a little bit wider down here. But again, very sharp, vertical along the side of the face, sharp jawline, and then a very square and widened chin. So we are seeing more males coming into our clinic to discuss sort of anti-aging and to sort of look at their male aesthetic. And there's definitely always been a bit of a stigma attached to males coming into a place like ours or any aesthetic clinic, because there's always this sort of stigma that this is more supposed to be for females, and males aren't supposed to be concerned about their appearance. Joe Jonas is now, just of last week, has become the face, so to speak, for Xeomin aesthetic, for Mertz aesthetic, for their Xeomin toxin. And he's been now quite open to saying, as part of his healthy lifestyle, which includes diet and exercise and skincare, using injectable agents like toxins will help from his anti-aging, from his healthy lifestyle. So that, I think, will, again, sort of give people some more confidence, give males more confidence to come in and chat with us, is that we're not going to make you look feminine. We're there to talk about your concerns and see if we can't give you some suggestions to whether it's anti-aging or whether it is to enhance jawlines or enhance something that you're uncomfortable with. There's definitely things we can do to make you feel more confident about yourself, to look a bit better, and not necessarily look like you've had treatments done. I've done these treatments, I do these treatments. I don't know if people really know that I would. I guess they would probably assume because of what I do. But I don't know if people who don't know me would really know that I do some of these aesthetic treatments, because again, it's just, the idea is to look good, to sort of look the way you feel on the inside. So we don't have to make you look different. We don't have to make you look feminine. We can definitely just enhance your natural inner beauty.